Hello everyone, welcome back to my channel, The Doc in Suit. So today is the first video on human anatomy, and this is an introduction video. Now before we get into the details of the human anatomy, we should first know what is anatomy. Anatomy is the study of structures that we can see grossly without the aid of magnification. I hope that's clear. Human anatomy is the study of those structures of the body which can be seen without the magnification. Now before we proceed further, there are some important anatomical terms that we should know. Starting on with the anatomical position of the body. So we stand straight, our legs together, toes facing forward, our face forward, head up, and palms should be facing outwards like this. You stand like this. This is the anatomical position of the body. Now we move further to anatomical planes of the body. There are three major anatomical planes in the body. The first one is coronal plane. Now when we talk of coronal plane, this plane is oriented vertically. So this plane, it divides the body into anterior and posterior portions. We can consider this as an axis. And this is an example of the coronal plane. So it passes on like that, and it divides the body into anterior and posterior portions. So this, my thorax or my chest, is the anterior portion of the body, whereas my back, the vertebral column, is the posterior portion of the body. Now we talk of the sagittal plane. Now the sagittal plane this plane, this sagittal plane, it divides the body into equal left and right halves. And the plane that divides it equally is known as the median sagittal plane. I hope that's clear. This is the sagittal plane, but the axis at which the body is divided into two equal halves, left and right, is known as the median sagittal plane. Then we move on to the horizontal plane. The horizontal plane is also known as the transverse plane. Now this plane divides the body into superior and inferior portions. Superior is the upper part and inferior is the lower part. It divides the body into superior portions and inferior portions. I hope these planes are clear to you. Now these are some more anatomical terms that we're going to use. We have anterior and posterior. You must have probably heard of them before. So what is anterior and posterior? Anterior is also known as the ventral part of, or the ventral side of the body. That is the front. And we have posterior. Posterior is also known as the dorsal side of the body. Dorsal is the back, anterior is front. I'll give you some examples. Our nose is anterior. It lies ahead of our ears. It's anterior to the ears. Then we have the vertebral column. The vertebral column is dorsal, or it's posterior to the sternum. I'll be telling you about sternum, vertebral column, all of these structures in our future videos. This is just an introduction video. We have medial and lateral. So we use medial and lateral terms with respect to the median sagittal plane. If I stand in my anatomical position, my palms facing forward, my thumb is lateral to my fingers because it lies outside. And nose is medial to the eyes, and eyes are medial to the ears. So this was about medial and sagittal. Then we have proximal and distal. Now when we use the term proximal, it means closer to the origin. And when we use the term distal, distal means farther away from the origin. I hope that makes sense. Closer to and farther away. So proximal means closer to the origin, and we use these terms proximal and distal usually with respect to limbs. And so proximal means closer to, and distal is farther away from the origin. So for example, my hand my hand is distal to the elbow joint. This is my elbow joint, and my hand is distal to this joint. Then my glenohumeral joint, that is the shoulder joint. We'll be discussing in the future videos as well. This is just an introduction video. So the glenohumeral joint, also commonly known as the shoulder joint, is proximal to the elbow joint. As you can see, my shoulder lies closer to the elbow joint, and my hands, they lie farther away from the elbow. Then we move on to cranial and caudal. So what cranial means is towards the head, cranium, towards the head, and caudal is towards the tail, towards the end. Now the term rostral is used in the head and with respect to nose. For example, our forebrain is rostral to our hindbrain. Now there are two last terms that I would like to tell you about. It is superficial and deep. Now these terms, superficial and deep, are used to describe relative positions in the body with respect to the body surface. For example, our sternum is superficial to the heart. It lies above the heart. It's closer to the body surface, whereas the stomach lies deep to the abdominal wall.